Great to be here with you all. So my name is Andra Bria. I'm a marketing manager at Medicai. So what are we doing at Medicai? What is Medicai? Medicai is offering the building blocks, platform, API, infrastructure that allow healthcare providers to access and manage medical imaging data in the cloud, enabling this way for high-value clinical pathways. So, how did we start? What is our story? What do we want to build for? And how do we see the future? So we started Medicai because we already had some experience in the health tech world. We previously built Skin Vision, which is a skin melanoma detecting app. Moving forward, we saw a big opportunity in the medical imaging space. Why? Because imaging produces the highest volumes of healthcare data. This amount of data is only increasing exponentially as the medical investigations become more complex. 90% of health data storage is represented by images, and imaging is crucial for specialty care, oncology, neurology, orthopedics, neurosurgery, cardiology, and more. But there are several problems here that we've identified in the medical imaging space. Which is the fact that it's starkly lacking infrastructure. Most of the places, CDs are the way that imaging data is still shared and stored today. And it's also locked on premises in hospitals or clinics. Doctors lack access to patient data whenever they need it, and there's no way to collaborate on this data online. It's very complicated to build with imaging data analysis, AI, clinical research. And this only leads to a longer process from suspicion to patient diagnosis and entailing high risks and costs and outdated patient journeys. We must allow healthcare data, including medical imaging data, to circulate freely. Healthcare organizations need to exchange data with one another, with internal or external networks, and solutions need to be very simple but flexible. Moreover, what do we see is value-based care rising, both in the US and globally. Value-based care providers need to create networks around them. They cannot work with siloed solutions. Virtual care providers also need remote access. They cannot work with on-premises hardware. And imaging is crucial for complex conditions, as I previously said. On the other side, there are new regulations that where regulators are pushing for access to data. Information blocking is now penalized. TEFCA, which establishes a framework for data exchange, introduced the concept of qualified health information networks. There are only 7 of them, but none do imaging yet. So there is an opportunity to democratize imaging data. Specialty care needs access to this data, and we can help this grow. As I've said earlier, we offer the building blocks for medical imaging data access, integration, and sharing. How are we doing this? We offer a cloud-native infrastructure which is flexible and scalable, a Medicai medical imaging archive, an imaging API, and building blocks. How are we doing it? We connect two imaging machines and we pull this data to the cloud. And the imaging data can then be transferred into the Medicai platform or embedded in any virtual care application or EHR. I'm going to show you a little bit how it works. Can you still see the screen?
Yes.
So this is inside the platform. I have here a doctor account where I can see the medical investigations of a patient. I can open the investigation. I can upload an interpretation. I can add a comment. And then I can upload any other kind of medical files like lab test results or medical records or investigations. And then what is the kind of a pillar feature of Medicai is I can share this case and these documents with my care team inside of my clinic or outside it with a radiology clinic by creating tumor boards, or just by collaborating through a link, or by inviting doctors or even the patient by email to have access to this data. What else we can do? We can start a discussion with doctors based on these investigations, and can start discussing treatment plans and so on. Also video calls, or even receive payments. I'm gonna go back to the presentation. Some of the most impactful projects we have been a part of is the tumor board project, which was initiated by doctors from US, Romania, and Moldova to provide life-saving treatments for displaced Ukrainians with cancer. The board used the Medicai platform to connect doctors, share medical files, and provide a platform to discuss treatment plans. Another project was one that we carried with Boehringer Ingelheim, where we connected pulmonology experts from 4 major centers of excellence to pulmonologists from remote areas of Romania, in order to reduce the time it took for a patient to be diagnosed with interstitial pulmonary fibrosis by 65% in just a year with Medicai. So, instant collaboration, remote consultations with ease, providing access to imaging data from wherever they are, either through the platform or through the mobile app. Asynchronous collaboration, digital tumor boards, real-time collaboration with referrers, second opinions, navigation services, and others. These are some of the use cases for Medicai. Looking into the future, as I've mentioned, we see value-based care rising. We can provide access to imaging data for value-based care providers by offering an end-to-end solution where the patient and the providers have access to imaging throughout the whole patient journey. Moreover, this data can be transferred to clinical studies or used for AI applications. We have over 70 organizations already using Medicai. We manage over 1.6 million imaging studies, over 8,000 doctors and over 8,000 patients, and over 5,000 doctors use Medicai. And we are slowly growing in the US market as well. I'm looking forward to hearing your thoughts, opinions, or suggestions. And thank you so much.